Hello, everyone, and welcome to another audio podcast with me, the Shientist. This is another Storm Robotics production under the series the Storm Impact, the LabZtorm Impact v.2. Today, I'm going to talk a little bit about records access, electronic patient records, and according to the British Medical Association, the BMA, and this is in collaboration with the Renal Patient Support Group, the RPSG. This works has been also presented. It's available through the Renal Patient Support Group, the RPSG. This works was also an invited book chapter in a particular book publication, and collaborators were from the UK and the United States in the invited book chapter in the invited book chapter. So in context with the British Medical Association, myself myself and a colleague, where both at the time were representing on behalf of the Renal Patient Support Group, the RPSG, were invited to highlight aspects in relating to electronic patient records and patient care, in line with specifically to those going through particular long-term conditions. At the time, the Renal Patient Support Group, the RPSG, would have been in its fourth year. So this was works going back to 2000, around 2014. So a bit of background around this. So patients, a patient's account for around 50% of general practitioner appointments, 64% of outpatient appointments, and 70% of hospital bed days. Around 70% of total health and care expenditure, at least in the United Kingdom, is attributed to people with long-term conditions, and people diagnosed with a particular long-term health condition, long-term conditions, are perhaps the most rigorous service users of health and of healthcare. Between 2010 and 2030, it is postulated that the number of younger adults with disabilities aged 18 to 64 will increase by just over 30%, and from around just over 30%, and the number of younger adults with physical and sensory impairments will increase over just over 7.5%, and an estimated of 15 million people in England and the United Kingdom have at least one long-term condition, with the prevalence of cancers, chronic kidney disease, and some others arising most quickly. And so this consequently has an impact on access to lives, broader healthcare services, and in line with population health. Already the 30% of the population with long-term health and with long-term conditions account for around 70% of NHS of a National Health Service spending. And so reducing the public's dependence on health professionals in some contexts and increasing empowerment empowerment and well-being is perhaps a more academic and effective way of provision. So despite overwhelming evidence, however, patients still face a number of challenges. It was in 2014 when one of my colleagues and I, when we were invited to the British Medical Association, which is not far from the Royal College of General Practitioners, RCGP, in London. We were invited to talk about aspects that were in line with electronic patient records. For example, the advantages and disadvantages around them, but also around, for example, where the board at the time, when we were invited at this sort of board sort of meeting, and we were discussing, there was discussion about where, for example, on the Renal Patient Support Group, or the RPSG at that time, what sort of things, what sort of areas of healthcare, apart from the obvious, what sort of areas of healthcare are patients or carers having issues around. And so my colleague and I at the time had highlighted that there are patients and carers who have real issues navigating aspects of healthcare because for example, apart from renal health or kidney health being the main issue that many of the members of the RPSG have, they also have issues in, for example, simple things such as transportation, things to do with things in relating to how to sort out aspects of aspects of one area of healthcare versus another area of healthcare. So, for example, apart from kidney health, where most of the service users or members of the RPSG have, apart from that, some and still to this day, some have, or a majority have issues or have had issues in relating to for example, being where they feel a sense of have a feeling or a sense of not being able to completely get sort of overall perspectives on a certain aspects of their healthcare, and not knowing who to approach or when to approach. And so as we were going through this discussion and this meeting at the British Medical Association back in 2014, it then prompted me to actually look at electronic patient records, or EPRs, but also where another colleague who wasn't actually at the British Medical Association meeting, it was another service provider who should have been there. However, I contacted this other colleague shortly after the meeting, after the British Medical Association meeting. This colleague was at another a primary care physician, and he and I talked about aspects of where, for example, different health professionals would probably be more useful in line with electronic patient records if, for example, library services would be more accessible. But of course, in the United Kingdom, libraries have been closing left, right, and centre since before 2014, actually. And so basically, I'm now going to talk a little bit about some aspects of electronic patient records in line with some of the aims and objectives of the works that got published in an invited book chapter when this collaboration took place sort of shortly after the British Medical Association meeting. So the objective of this work was to also highlight the importance of integrating general practice services or primary care physician services, electronic patient records, and library services, and explore why it is also advantageous to implement patient-centered multidisciplinary team sort of meetings or MDTs in primary care. Multidisciplinary teams meetings, by the way, at least between primary care, between primary healthcare sectors and secondary healthcare sectors, what it actually means is basically where there are sort of pathways where basically different health professionals, different healthcare professionals can be or could be available for what are known as group consultations, and primary care physicians in the United Kingdom have actually in some part have implemented group consultations, although they're not completely multidisciplinary. Mainly they focus on primary care physicians talking to or communicating with other primary care physicians, and perhaps nurse practitioners, for example, and so in line with that, the other perspective was to highlight in this works was to highlight the use of the Renal Patient Support Group (RPSG) platform to collect basic understanding sort of on these sort of entities. So before I get into that, I'm now going to talk a little bit about, or highlight a little bit about the issue with current practice. Apart from some of the points I've made already, I'm going to provide a little bit more perspective on this. And and what I'm going to highlight were aspects that I talked about, and at the time were not documented. They were more points that were raised in this British Medical Association (BMA) meeting that took place back in 2014. So the issue with sort of current practices, and these practices and current practices actually still mean the sort of prospective practices that still align to areas of healthcare between health sectors, at least in the United Kingdom. So although research has provided valuable insights into the ways patients use healthcare services, it is difficult to determine the precise understanding of such a wealth of information information across different illnesses or long-term health conditions. It is important to gain better insight into the type of stresses experienced by patients suffering from different diseases, as information on the nature of disease related stressors may contribute to better understanding of patients and the general public. So by implementing by implementing sort of more integrative health services or integrated services, at least between health sectors, and improving healthcare experiences, this could improve well-being and progress general healthcare. And there is literature out there that have talked about some aspects of services in different by different authors. So in line with this now, understanding how patients and the public access information generally it has been important between the Royal College of General Practitioners, the RCGP, the British Medical Association, the BMA, and also amongst other organisations. So it's thus important, considering many may feel less positive about their own competencies. And I use that word competency quite loosely, because remember, it was in more recently in a paper publication in 2017. There was a paper to highlight that patients did not between where researchers and investigators were trying to identify, for example, on social media platforms, for example, when people discuss and talk in relating to, for example, lived experiences. In this particular paper publication in 2017, they highlighted the fact that how patients and carers discuss lived experiences or share experiences doesn't really, apparently in this publication in 2017, doesn't highlight, does not amount to, is not amounted to what would be deemed as clinically significant or clinically relevant context in keeping with healthcare and service providers. And so with some and in line with this, also in line with this, with some who may feel inadequately prepared about healthcare, and this places them at a higher risk, quite obviously in some regard, for poorer healthcare when compared to their peers. So, for example, someone going through one particular health condition versus another person with the same health condition, or a person who is going through a different healthcare condition. So there are papers that have published some of that context as well. So there needs to be a broader access to knowledge and understanding, such as directories, information leaflets, documents, books or publications in relating to, for example, lifestyle, helpful contacts, and sources of information that can support patients and the public on the most important elements of healthcare. And of course, the British Medical Association meeting, my colleague and I at the time when we were invited to this highlighted some of this context, but also the publication, the invited publication for this work was also highlighted this context from also the another paradigm, which was actually the library services aspect. And library services, as I said, have been taken away in the UK, in the United Kingdom. They've been sort of closed in different regions across and up and down the United Kingdom. So then, as part of the sort of intro to this particular topic, I've highlighted about the fact that in the remit around aspects of healthcare generally have been whereby, for example, there's where published works have highlighted that reducing the public's dependence on health professionals and increasing their sense of empowerment and well-being has been perhaps a more effective way of seeing challenges being met. However, on the contrary to this, is that it cannot be achieved through just patients accessing their electronic patient records, of course, and general practice in particular, general practice or primary care physicians are defective in their own sort of mindset, because basically primary care, a bit like secondary care, is a bit like secondary care. Both sectors generally focus specifically on aspects of their own service provision. Thus, have retrospectively historically have been working in silos. So that being said, the issue with current practices, and when I mean current practices, I'm now talking a little bit about between primary and secondary care health sectors, is that there is a lack of integration not only between the sectors, healthcare sectors, but also between health sectors, between primary care and integration in the community. Because let's not forget, if library services have been taken away, for example, as a typical example, libraries, a bit like other areas in primary care, if they've been taken away or stripped away or cut out of general areas of service, then basically it fragments and it segregates quite harmfully communities. Communities then get segregated and fragmented in relating to what is known as population level, thus leading into areas of disenfranchisement and impoverishment. This then leads into the next aspect that I'm going to talk a little bit about, and again, these were talked about at least in part more informally at the British Medical Association back in 2014. But again, the works the works were this works was published was published in a invited book chapter. So the next thing I'm going to talk a little bit about is health literacy. Health literacy generally across between healthcare sectors is actually pretty much paramount, because to navigate aspects of healthcare, there's certain terminologies that patients and carers have to be accustomed to, or have to know. And that's not just me saying that. It's actually evidence out. There's evidence to indicate that if patients have understanding of clinical context, it increases health literacy. It then allows them to navigate healthcare. But again, I bring the point back into what the provision of library services are all about. And again, they've been taken away in the United Kingdom. So the use of the internet and social media use doesn't actually suit everyone. However, in contrast to some of the above context, patients whose first language, for example, is not English, approaching more methods to support health literacy will be challenging. Health literacy is what's known as predominantly a skill-based construct that does not include motivational elements, and using methodologies to improve health literacy along with, for example, electronic patient records alone, to determine the needs of patients and simplifying aspects of healthcare for them as a result may be a barrier to that person, thus affecting the patient and professional healthcare professional paradigm or dynamic. As such, the patient may gain some of the understanding, however, does not have the mindset. They may not have the mindset to actually take action. And again, if you think about library services and how they've been taken away out of have been taken away in the United Kingdom, for example, then alongside this, sort of automatically patients and carers do not automatically have the mindset or the attitude to want to improve areas improve focuses around areas of healthcare, There's work actually by an author known as Salter and team in 2014 that actually highlight that what can be learned from patients living with, for example, chronic musculoskeletal conditions, healthcare professionals and carers about the concept of using around the concept of health literacy. The team, Salter and the team, highlight that patients desire predictable interactions and search for more than knowledge, empowerment, and responsibility from their interaction with healthcare. So what this means is automatically healthcare service users versus providers generally have a more desire to interact with healthcare or navigate aspects of healthcare, but the opposite is also true for those who are healthcare professionals. They do not have the same desire to interact with patients, at least from a particular perspective. And it is possible to inform and interact it is possible to highlight the um, um, patients from different backgrounds um, if they are provided with what is known as, for example, well-designed context and information, and given appropriate informed decision support by well-trained health professionals, then generally there can be a sense of a sense of uh, a sense of uh, evident empowerment. Importantly, though, more evidence has shed light that people, those with low health literacy, for example, tend to refer to health professionals more quickly than wanting to look and identify information themselves. So in line with this, so they defer to health professionals to make to the point where they rather, at least historically, they rather have a health professional make a formal decision for them. To put in context, if someone has a particular test or investigation, and then after having that test and investigation has the result around that test and investigation, then goes to the health professional and asks them, well, should I have another blood test? Should I go on is there a particular drug for that area that can be treated, etc., rather than actually where health professionals and patients and carers should be communicating, where there should be almost bi-directional or tri-directional communication. And so this also tends to have less positive healthcare outcomes than people who are more actively or proactive in areas of their healthcare. Now, alongside with context that my colleague and I were talking when we were invited by the British Medical Association. We talked a little bit about a little bit more around the Renal Patient Support Group, the RPSG, but also in line with electronic patient records. So there is compelling evidence that patients who are more proactive in managing aspects of their healthcare, accessing their healthcare records, have better outcomes than those who are passive service recipients. And there's works by Stoves and team in 2010 and Stoves and team in 2014. The commitment made by the Department of Health in general practice, at least in 2015, that all patients will have or should have access to electronic patient records. And two main points here was that all practices, all primary care practices, will be expected to make available electronic patient records and cancelling of appointments, ordering of repeat prescriptions, and communication with general practice or with healthcare practices. The Royal College of General Practitioners, the RCGP, agreed to take forward this work and agreed to take forward aspects of the remit around electronic patient records and what was and something that's known as the Patient Online Roadmap, which highlighted some important principles. The Patient Online Roadmap, by the way, it's a document where one of my colleagues from a primary care perspective had involvement, and the Patient Online Roadmap is available. It's available publication online, and it's free. It's freely available, which highlights more aspects around electronic patient records, more specifically around primary care. Although there is context in relating to secondary care service provision as well. So, in line with this, also there is evidence that this can improve patient and carers' understanding and the level of participation. Let's not forget, where participation is concerned, or where participation is concerned in relating to service providers, if they can't navigate aspects of healthcare, and if they don't feel empowered, then generally it leads to more inequity. And so, in line with this, it can improve patient and carers' understanding and level of participation, as well as being able to sort of cope and cope and lead to as well as being able to cope and sort of being able to have better health outcomes. There's works by Coulter and Ellins in 2007, and the report. I think the report in 2007 is a document, a report or a document that the main remit is something on the lines of no information about me without me, and there thus needs to be a sort of or historically there needed to be for those for those who are service users, but of course the general population. There historically there should be neutral environments where both at population level, patients and healthcare professionals sort of come together to provide more awareness of, for example, number one, the sort of issues and contentions they have around aspects of healthcare. And what I mean in this context is just so for example, where someone might go and visit their primary care physician and highlight an issue that they may be having, but rather than for example online, which is more current, rather than online, through remote centered areas, remote centered sort of technologies, but primary care sort of surgeries, rather than those sort of environments, the neutral environments, in this context at least, where the works had been published, where those neutral environments would be or should be those library services that again have been taken away. And so in line with this, where patients and the public can source additional literature and context pertaining to aspects of their particular conundrums or their issues. Electronic patient records learning and development can be taught and achieved, or could be achieved or can be achieved through what is known as library-based partnerships. And basically, one of the other lead colleagues when this works was developed is also from a primary care physician background, had suggested that library-based partnerships in line with healthcare would be sort of more, would allow more integrative practices, at least in the general public, amongst the general public, but also generally at population level. So also in line with the British Medical Association meeting that took place again in 2014, we talked a little bit about patient-centered multidisciplinary team meetings. And back then in 2014, the terminology around group consultations wasn't really world renowned. Group consultations now are sort of everyday, as far as literature has documented, and so for a long time, multidisciplinary team meetings have traditionally taken place in secondary care, with healthcare professionals in a particular specialty coming together to discuss to discuss a sort of care plan for those who the healthcare professionals have centered their care around. The meetings have always taken place mainly in the background, and what I mean is that, for example, in multidisciplinary team meetings, for example, a bit like ward rounds, ward rounds in secondary care, what happens is that once ward rounds have been done, the team who've done the ward rounds would have meetings around those different patients that they would see in and around their ward rounds. And then the meetings would multidisciplinary team meetings would technically take place behind closed doors. So generally speaking, multidisciplinary team meetings historically are about the patient, but the patient has never really been involved. And if a patient has a carer, the carer is never really involved. So whilst it would be challenging to perhaps have patient-centered multidisciplinary team meetings in secondary care, this should be explored, or it should be explored at the primary care level to increase healthcare integration and further electronic patient record awareness. Because let's not forget, the remit around this meeting in the British Medical Association, again back in 2014, was more around electronic patient records, and generally my own sort of issue around electronic patient records is that they are very new. The electronic patient records, when patients access their records, at least historically, have been more numerical. So after after patients or carers have appointments or meetings with a healthcare professional, would document or dictate some aspects of that sort of meeting, but the qualitative aspects, the words aspects of that particular meeting would not be documented on the electronic patient record. The information would be documented in the patient's notes in shorthand, and basically in line with this, the idea at the British Medical Association meeting that took place in 2014 was to sort of highlight some the issues around electronic patient records, but also explored issues around primary care and the integrative and the lack of integrative practices. So the notion of patient-centered MDT multidisciplinary team meetings would increase knowledge and understanding of health at various stages of care, and where health professionals within practice can and should physically involve a patient. They seek to discuss healthcare, discuss aspects of healthcare with. So in line with this as well, there should be when this works was published, at the time we highlighted that there should be a call for a more research that looks at physically involving patients, and encouraging uh, sort of different people in those multidisciplinary team meetings to make informed and shared decisions. So having access again to electronic patient records alone, and by the way, primary care physicians are still hell bent on having electronic patient records as the pinnacle of their practices, and unfortunately, patient care then kind of does not. Patient care sort of um, dwindles from that remit. So having access to electronic patient records alone will not and does not help or encourage a patients or carers to gain confidence and or understanding around aspects of their healthcare, especially if they are overwhelmed by healthcare choices and, of course, health literacy complexities. And patient-centered multidisciplinary team meetings could allow or should allow patient and carers to gain more understanding, more comprehension around electronic patient records, and sort of an understanding of what tests and investigations that they have actually mean. Shared decision making may involve rethinking, or should involve a rethinking of the clinical pathway to incorporate time for information provision around healthcare. And so what this work also did, or at least in following in part after the meeting that took place at the British Medical Association in 2014, what we then did, what then happened is we did is that I implemented a small investigation with members of the Renal Patient Support Group, the RPSG, and I'm going to just highlight a little bit around this because there is some context or some perspectives that came through members of the RPSG, and this work hasn't been presented. It has been published, but it hasn't been presented. And so I'm going to talk a little bit about what happened here. So the RPSG is a non-funded is retrospectively a non-funded, primarily a non-funded social media platform, which was and still is a patient-led initiative established in 2009, and there's two co-founders to the RPSG, and mainly and primarily stem from founded in Bristol City, England, UK. So unlike other renal related groups or social media groups, the RPSG is and has a research essence as well. At the time, the RPSG, when this work was implemented, the RPSG had 10 members of the administrative and research team, with representation from the United Kingdom, parts of Europe, Australia, and the United States, who are and were responsible for moderating the group. At the time when this work was published, around 2014, as well, at least put in context of an overview. At the time in 2014, the RPSG had over 5,700 members globally, supporting each other, with members providing insight on their experiences and shared decision making. And since the RPSG is mainly a social media platform, this lent itself well to raising chronic kidney disease awareness, allowing members to share lived experiences and real life stories. So all RPSG members were eligible to participate, to post comments on the following. Do you think patients should be physically involved in multidisciplinary team meetings? And before inviting members of the RPSG, the Renal Patient Support Group, to participate in answering this question, they were invited to read the RPSG disclaimer. There's a general disclaimer which relates to research consent and requires that members are aware that they are welcome to contribute in any any data collection in studies through the social media platform. And if anyone feels uncomfortable contributing, they do not have to post comments at all. Clear information about the study or this small investigation, was made available, and member privacy and confidentiality was protected, keeping comments anonymized. So, in line with this, all existing RPSG members were able to access and contribute to the thread that surrounded this particular question at the time. I'm now going to highlight a little bit around some of the I'm going to highlight some of the main comments. I just want to highlight, before doing that, there were actually, when doing this back in 2014, the RPSG received actually over 50 comments specific to this question. But here are just a few. So number one, absolutely yes. When wanted by patient, possible and practical, would help answer questions immediately rather than often wrong assumptions being made. Also means I understand better what's going on and why a particular course of medication or medicine, for example, may be recommended or being recommended. Number two, also, I would love to be involved. I mean, it is us they are talking about. So there's a patient, I think it was a patient or a carer, talking about basically how multidisciplinary team meetings, where they would like to be involved or love to be involved, but and especially knowing that in MDT meetings, multidisciplinary team meetings, they know that that health professionals are talking about them. Number three, so absolutely, quite frankly, it's frightening that we are not involved in planning our own care. Number four, think an MDT with patient or carer involvement would work very well for people with long-term conditions or LTCs. Number five, education being behind purpose, education behind purpose or objectives of an MDT to fellow patients and carers would resolve any hurdles, etc. Piloting can help measure feasibility and provide necessary feedback before any formal implementation. Number 6, patient involvement and MDT meetings are essential to ensure that other comorbidities and treatment is considered, understood, and included in future plans. Unfortunately, in my case, this is a patient who wrote this comment, and so unfortunately, in my case, different consultants do not communicate across to each other. And finally, the 7th comment, I've only added 7 here in this overview. Yes, 100% always said that. So in line with this, then I'm now going to talk about although I've talked a bit around aspects of library services, I am now going to talk a bit about developing a little bit around developing libraries and healthcare and health partnerships. This context is where my collaborator, one of my collaborators, had more expertise around this, but I've documented this context. This context was documented when this work was done. So the need for general medical practitioners to work close partnership with educational professionals was highlighted some years ago by Robert MacDonald in an occasional paper number 64 from the Royal College of General Practitioners, and it's a publication by MacDonald in 1994, who says, and this is a direct quote, for patients to become fully interactive with their treatment and care, there needs to be a huge and sustained educational program developed within primary health care. And so the need for patients to be fully interactive with their healthcare has more recently been highlighted in what's known as the One Less report in 2000. I say more recently, but actually it's a little bit over now. It's the One Less report was published in 2004, which actually estimated or highlighted that fully interactive patients and carers were likely to save the NHS, the National Health Service, millions of unnecessary spending. Similarly, the importance of supporting patient education and patient and carer learning was also emphasized in the report. And there's another report from the Rockies and Rhondda. It's a report that was published by the Welsh National Health Service Confederation in 2014. The General Medical Council, the GMC, in its updated document Good Medical Practice, GMC 2013, again, this was 2013, between two. The works came out in line with the meeting that took place with the General Medical Association, and so this this document from the General Medical Council was published in 2013. So Good Medical Practice document 2013 insists that doctors must give information to patients in language and terminologies that they can actually understand. And the information should relate to conditions and treatments available, together with possible adverse effects and procedures, so that patients following GP or consultant consultations can truly give informed consent to their treatment to treatments, procedures, and certain pathways. This is clearly quite impossible in the time available during an average GP consultation, at least apparently, owing to the fact that GP consultations are historically between 7 and 11 minutes long, and even more impossible when the language and the culture of the patient is not shared by the doctor. Just to emphasize a little bit of a point around this, is that as part of doctors' surgery appointments, generally doctors have the ability to signpost patients to resources. However, in doing that, in that time, again, patients and carers rather in at least part context rather have health professionals make decisions. Number two is that through signposting, there's no guarantee that the patient or carer has the appropriate literacy level to know and navigate aspects of health. Number three is doctors or those medical professions at GP level or primary care physicians, when signposting, they signpost to those for example, organizations that in part may have affiliations with them to some extent, but also where, for example, where primary care physicians have in a way benefited themselves. And so even more impossible is when the language and the culture of the patient is not shared by the doctor or by the healthcare professional. And so in the above regard, it would be more sensible, or it is more it would be more sensible, open quote, close quote, sensible to actively encourage health and library partnerships at primary care level, so that patients and professionals have a neutral place for educational material and best use of resources. Libraries, at least historically, were equipped with resources in various languages, which could aid to support ongoing care and increase health literacy. Library and health partnerships could or would also allow electronic patient records, awareness and training, and locations for multidisciplinary team meetings between patients and healthcare staff. I notice how I said healthcare staff, because traditionally healthcare or healthcare staff has normally meant a doctor and patient, or a nurse and patient. When I mean healthcare staff, I mean lots of different healthcare professionals being available actually in neutral places, and also which can be arranged in arranged in sort of the private areas of those, or at least then private areas in libraries, because let's not forget, in most libraries there were sort of private areas where patients, for example, patients, carers, and health professionals could actually have sort of those important discussions. So now I'm going to highlight a little bit around some context around the main points, sort of the main points. So these main points are in keeping with the meeting that took place around the British Medical Association. So then there is now a requirement for general practitioners to enter dialogue with sort of those services out in community to prompt tighter, broader, to prompt integrated services in primary care, in areas of primary care. Electronic patient records, or EPRs, need to be supplemented by decision support, personalized areas of personalized care planning, and self-manage and sort of educational tools from different trained health professionals, as well as those who are aligned in sort of other areas of services, family, for example, as well as those from other areas of health sectors. There needs to be a neutral environments where patients and health professionals can sort of come together to provide more awareness of electronic patient records, in addition to where at population level and the public can source information, not least literature and resources that can help and that support. Patient-centered multidisciplinary team meetings would allow patient and carers to gain more electronic patient record awareness and understanding of what their investigations mean. Health literacy, as I mentioned, is predominantly a skills-based construct that does not really include motivational elements. And using different modes to improve health literacy alone to determine the needs of patients and simplifying instructions for them as a result may be more of a barrier to that person, and so thus affecting patient and health professional paradigm. And so there is an ongoing need to support and work in partnership, really, to increase awareness of those services in healthcare. So what needs to so I'm just going to say what really needs to happen, and most of this most of what I've highlighted was highlighted in the British Medical Association BMA meeting that took place in 2014. So by encouraging partnerships and inviting patient and public involvement, where patients and public involvement can effectively and efficiently add to important discussions. And so there is now a need for GPs and healthcare professionals generally to enter into dialogue with sort of those local services to prompt integrated services in between healthcare sectors. And partnerships, sort of those partnerships would not merely enable an individual to better understand their health, healthcare, but it would also actually encourage them to be more models of around expertise, and would also bring about a deeper sort of a public understanding of interaction in between healthcare sectors. There just a few concluding points. So given that more patients and the public have opportunity to access sort of their health records, a sort of a libraries and health partnership could be an enhanced sort of methodology that integrates primary healthcare better, thus allowing all to access health-related literature, including books, leaflets, and digital media, in a comfortable environment, in a setting that also has staff that can support with health literacy and technology. So the question in this particular this publication and aligned that came out after that was constructed after the British Medical Association meeting in 2014. The main question was around this work was, is it not time to integrate primary care for the better? And the answer is yes. There must be more unilateral thinking to ensure inclusion of different populations when developing or improving healthcare services. Partnership working can also allow reliable professional help and advice that patients and the public need at the time that suits them, and in a language or a format that they can understand and from which they can actually learn and develop. And finally, an electronic patient record and multidisciplinary initiative should be supported with library and healthcare partnerships, and this needs to be encouraged, and it hasn't happened. Unfortunately, and still needs to happen. So there are some citations and some references. I won't go through the whole the list of those, but again, this work was titled Electronic Patient Records, Library Services and Multidisciplinary Team Meetings. Is it not time to integrate primary care for the better? And there were 4 of us who collaborated on this, and it stemmed from the British Medical Association meeting that took place in 2014. This was a collaborative, the publication was a collaborative effort towards a book chapter, and it was from colleagues in the United Kingdom and a colleague from the United States. I want to say thank you for listening to this audio podcast. Again, feel free to use the timestamps to listen to the more intricate sides of this audio podcast if warranted. This has been the Shientist. It's been another Storm Robotics production, and the audio podcast. And the audio podcast series, the LabZtorm Impact v.2 records access and electronic patient records according to the British Medical Association. Thank you for taking the time to listen.